Hi, I'm Dr. Nachiketa Mohapatra, newly joined at AMRI Hospitals, Bhubaneswar, as a histopathologist and cytopathologist. Basically, as you all know, that histopathology deals with tissue diagnosis, and it is important. Why? Because most of the cancer-related surgeries require a definite diagnosis on which the further treatment is required, and definitive treatment protocols are designed based on the histopathology reports. And myself, I have 20 years of experience in this field of histopathology, and I have a special interest in renal pathology. In renal pathology, I have done a fellowship and seeing renal pathology for the last 15 years. Also, I have a fellowship in skin pathology, and I have been working in it for the last 5 years. As you know, in histopathology, particularly if I talk about renal part, uh, it also includes all the transplant related biopsies on which an urgent treatment is required based on the histopathological diagnosis of graft biopsies. So that's the reason why graft biopsies are done post transplant, and this gives a definite idea about whether there is toxicity of immunosuppressive drugs, or whether there is a rejection, and if there is rejection, what type of rejection, especially if it is a B cell rejection or a T cell rejection. Depending on the type of rejection, the therapy changes, and accordingly the graft can be actually rescued from undergoing chronic graft rejection. So this is a very specialized field, and it requires a lot of expertise, and we have a department which is actually geared up for it, and most of the technical staff are also being trained for this particular renal and graft biopsies. Apart from this, as you know, histopathology is very much important in cancer diagnosis. So we are there to help all clinicians, everyone in the all from all faculties, to serve good diagnosis on which therapy can be given. Our department actually has a lot of modern machines, like the frozen section machine, tissue embedding, and tissue processors, which are top class quality tissue processors, and this actually gives us our advantage over all the other hospitals. Also, we have the immunohistochemistry panel of about 100 antibodies, almost nearly 100 antibodies, which help us in a particular molecular diagnosis of cancer, and this is very specific and helps us in giving a definite diagnosis. And similarly, immunofluorescence is required for renal biopsies. That also setup has been done, and we have a very good immunofluorescence microscope, and for all the native kidney biopsies for immunofluorescence studies. And these are all molecular tests, and we go up to the cell level to understand the morphology and as well as the antibody in the cell, so that we can actually give what cell line the tumor belongs to in cancer, and what type of antibodies are involved in a nephritis or a glomerular nephritis in kidney biopsies. And also in transplant biopsies also similarly, immunofluorescence to see the basic disease, if it is recurring in the graft, or a transplant related rejection in which C4D is done to confirm the antibody mediated rejection.